May is Stroke Awareness Month, and before we head into June, UI Health wants to spread awareness of the kinds of stroke and their differences.
UI Health's team of expert neurosurgeons is hard at work at the forefront of stroke and aneurysm care, and Dr. Fadi Charbel joins us with more. Dr. Charbel, thanks for being here.
Pleasure.
We're so happy you're here. So when we talk about the types of different strokes, there's two main types. Can you break that down for us?
Absolutely. So the two main types are either that there's not enough blood that reaches the brain. Those are called ischemic strokes. And the second one is where there's bleeding that happens inside the brain or around the brain, and those are hemorrhagic strokes. So two big types. The first one is the more common. The second one is more dramatic, but they're both potentially very dangerous.
Do you know which one you're having or you've had as it's happening, or?
Somewhat. That's a great
Okay.
question. A hemorrhagic stroke often is accompanied by a headache. And the most severe type of hemorrhagic stroke is associated with the rupture of an aneurysm. And the key point here, take away message for our audience, is that this characteristic thunderclap, very sudden, very violent headache, unlike anything anyone has had before. So if that ever to occur to the person or a family member, please don't ignore it.
And how are aneurysms generally, in terms of diagnosed and treated?
Yeah, not easy.
Okay.
Because unless they rupture, which we of course don't want them to do, they're silent. People don't know they have an aneurysm. So the way to find out about it is if, say, a person has a family history, then they get a study of the blood vessels of the brain. And there's a way to do that non-invasively. There's a technique called an MR angiogram, so it has no radiation. There's another technique called NOVA that was developed at the University of Illinois in our laboratories, again, non-invasive, that has the advantage of showing pictures and measuring blood flows. So those are two ways to do that. And once that diagnosis is made, it's really important, and I'm glad you brought it up. So what you see here is on the screen is some technologies that help look at the blood flow in the brain. But once that diagnosis is made, it's really important to then consult with a team that has a comprehensive ability to offer and discuss whether it should be treated, not treated, what are the alternatives, what are the risks of the treatment, and what's the best way to do it. So at our university, at our center, it's a comprehensive. We're the first one to actually implement this care for over 20 years now, where a team of people gets together and we devise the most effective and safest way to treat aneurysms.
The science and technology of it is just amazing, of what we're able to do now. We always hear that time is of the essence in these scenarios. So you mentioned the thunderclap. As soon as we feel something like that, it's 911. It's come
911.
see. Yeah.
Yep. Key. So what you're doing here, first of all, thank you for doing that. This is public service. It's important for the people that hear this. If you think you have a stroke, play it safe.
Yeah.
Call 911. The worst thing that can happen, people will evaluate you and you'll get a checkup, right? But if it is a stroke, you mentioned it, Sarah, time is of the essence. And when it comes to brain tissue, it's hard to bring them back. There's some recovery, but it's difficult. So better to prevent.
And you said that thunderclap, that's like a headache like you've never had before.
Never had before.
Okay.
So it's not, I have a headache and I usually have a headache and here it is. Yeah. What I tell my patient usually is if you're wondering if it's an aneurysm headache, it's not.
Okay.
Right? Because it's something very, very unusual.
And when you're talking about the two types of strokes, the
Yep.
one where it bleeds and the one where it doesn't, which one leaves someone with paralysis?
Yeah. So that's a good one. So let's talk for a minute about ischemic stroke. Ischemic stroke, more common, 70–80% of strokes, meaning there's something that happens, the blood vessel gets plugged. Not enough blood reaches the brain tissue suffers a stroke. And that has risk factors, smoking, blood pressure, genetics, cholesterol.
Right.
Those are things that people exercise. You just had a segment of exercise, that's really good. And the way to treat that is complex because you have to have a multidisciplinary team that addresses the various types of stroke. Now, I want to put in a very special subtype of stroke because we're in Chicago. It's called Moyamoya disease. The difficulty with this is it can affect children as well as adults.
Oh, wow.
And it's not recognized. Where is it common? Here in Chicago, we have Unfortunately, a lot of sickle cell disease. That's a disease that involves clotting in the blood vessels of the brain. So Moyamoya disease is not recognized. These kids or adults can have strokes, but they're not recognized because they're all healthy. People don't realize they're having a stroke, and there are treatments for that, like a bypass and so forth.
Wow. Incredible
Fascinating.
information. Thank you so much, Dr. Avadi, for being with us. For more information, you can scan the QR code on your screen, give them a call, or head to brain.uihealth.care.